welcome to another edition of Inside CRCAIH. I'm your host, Melissa Buffalo, and today we are with CHAT, which is Choices for American Indian Teens. And the objective of the CHAT project is to reduce the risk for alcohol-exposed pregnancies among American Indian female adolescents by determining the feasibility and acceptability of the OSD Choices program among rural American Indian teens. We will develop a transdisciplinary community-based program, which is CHAT, to prevent alcohol-exposed pregnancies with female American Indian teens, an area of great need but with few current efforts. They will expand the current clinical practice by utilizing an ecological framework to impact not just alcohol-exposed pregnancies risk, but also teen pregnancy risk and substance use behaviors. So the CHAT staff includes Ms. Tess Weber, Dr. Jess Hanson, and Umit Shrestha. So welcome, and if you guys could just tell me a little bit about yourselves.
Sure. My name is Jessica Hanson, and I've worked for Sanford for the last 10 years. And I've worked on the Choices intervention since 2004, or Choices type intervention since 2004.
Awesome. Welcome.
Thank you.
And Tess?
Yeah, my name is Tess Weber. I've been at Sanford for about a year and a half now.
Thank you. Umit?
Hey everybody, my name is Umit Shrestha. I just got on board a little over 5 months now, and my background is in sociology. Finished my PhD from South Dakota State University in sociology.
Awesome. Again, welcome. So Jess, tell me a little bit about CHAT, and maybe provide a little context in regards to choices, which some folks may be familiar with.
Sure. So the focus of our research is to reduce risk for alcohol-exposed pregnancy and fetal alcohol syndrome, and we do that by either reducing alcohol, drinking levels, or we also look at reducing risk for unintended pregnancy through contraceptive use. And so this intervention called Choices is evidence-based. It was tested with a large number of women from the South, and the Oglala Sioux tribe received funding to look at the feasibility of it with their tribe. And so I've worked with them since about 2012 to implement Choices with the tribe. And we collected enough data to show that this intervention works. Another part of our work did a community needs assessment, and those focus groups told us that we should implement this with teens and adolescents. And so we received a grant to do that, and so right now we are doing a lot of interviews and focus groups to modify Choices for teens, which we call CHAT.
Okay, great. Tess, can you tell me about how technology has been used to update Choices for teens?
Yes, so one way that we're trying to engage teens a little more is to develop the curriculum online using REDCap. REDCap is a tool for online survey development and data management. So how it will work is the teens will come in and sit with an interventionist that will have an iPad, and they'll be able to flip through the curriculum that way. And it will make our jobs a little easier too with the data management.
And Umit, can you talk about your role in CHAT and what you've learned as a postdoc over the last few months?
Sure. So my role within CHAT is to help, obviously, to make CHAT fit to the community. I do qualitative data analysis. So my role has been traveling to the community, doing a lot of key informant interviews and analyzing the data so that we can get the themes for our program. Some of the things that I've learned as a postdoc, obviously I have had a lot of interaction with the community of the Oglala Sioux tribe, so that has been really helpful in understanding their perspective within research, which is very important for social science research. So I think the exposure to to the community and to understand their perspective has been the big learning point for me.
Awesome, that's great to hear. And lastly, I guess, is there anything that any of you would like to share about CHAT and the work you do in some of our tribal communities?
Sure. I think the most important thing is that this project, our Choices program, and now CHAT, couldn't be successful without the great input of the tribe and the involvement of the tribe. So we have a new interventionist who just started a few weeks ago, and we did a training last week on motivational interviewing, which went really well. We brought in our consultant, my mentor, Dr. Karen Ingersoll, and so she did an MI training. She talked to us about FAS prevention and the great need to focus on that as an area of public health. So I would say that working with the community and the tribe has been a great experience, and again, we would not be where we were at without all the input of the community.
Oh, that's great, and I really love to hear that. So thank you for your time, And we'll see you on the next edition of Inside CRCAIH.